My name is Jason Schuster. I'm a doctor of physical therapy. Before that, I was a fly fishing guide in Patagonia, Chile for a decade. Now I own a continuing education company teaching other doctors how to do a couple things, including dry needling. This is a part of my online dry needling class, Online Dry Needling 1, Dry Needling in the Autonomic Nervous System. This is about how to specifically target the autonomic nervous system with dry needling. This is a great course, you guys. You can check it out on our website, intricateartseminars.com. Check out the first part of this video series on my YouTube channel. Hope you guys enjoy it. Electrical dry needling, you guys, stimulates significantly more or a significantly higher release of endogenous opioids throughout the brain and the body as other types of needling does, per a bunch of literature, you guys. So I like electricity in general. I think it's important to use electricity every time you needle, no matter what, because at the very least, pushing an electric current through the body helps redistribute normal electrical potentials throughout the different tissue types, right? So if you think about a bathtub with a bunch of balloons of salt in it and you start popping those balloons, through osmosis, the salt starts distributing throughout the water, right? If you have the full balloons of salt, that's kind of like our pathologic tissues, you guys. It causes much different electrical charges inside the balloon than outside the balloon, right? So the balloon you could think of as like a trigger point. You pop the balloon, you release the trigger point. All those chemicals inside the trigger point and everything redistribute throughout the tissues. New blood comes in, takes it away, flushes it out, normalizes the electrical potential of the cells. That leads to decreased random muscle firing and all that stuff. So I really like to use electricity. I use it on 100% of my patients, and I like to use low frequency electricity, you guys. So this is very consistent across dry needling literature, acupuncture literature, wound healing literature, regular surgery literature where they're looking at electricity, vagus nerve stimulation literature where they're doing the surgical implant and the ear stimulation, you guys. 1 to 5 hertz is considered low frequency in the literature. So 1 to 5 hertz has been consistently shown across fields in medicine to be the most calming on the sympathetic nervous system. So it depresses sympathetic hyperactivity the most. And one of the ways in which it does that is it releases more beta endorphin or more endogenous opioids into the body than other frequencies of stimulation do. So it's very rare for somebody to go into physical therapy or a doctor unless they have some type of discomfort somewhere. So decreasing pain is one of the most important things we can do for a huge percentage of our patients. Beta endorphin is the strongest endogenous opioid that we've found in the human body so far. It significantly decreases pain, you guys. And beta endorphin, it doesn't only just do pain killing, you guys. Nothing in our body just does one thing, first of all. We talk about things like they do just one thing, like interleukin 6. We only talk about that one as a pro-inflammatory peptide. It does lots of other stuff. We just don't understand what it does. We don't talk about it. Same thing with beta endorphin. We do know that beta endorphin is actually produced by some white blood cells. I think the macrophages and some other white blood cells produce beta endorphin. We don't really understand like what it's doing when the white blood cells are producing them, but it's important. And we know that beta endorphin gets depressed with chronic sympathetic hyperactivity. We know that low frequency electrical dry needling with 1 to 5 hertz induces beta endorphin the most. So that makes perfectly good sense to me why we would want to use that frequency more than other frequencies. I like to use 1 hertz, you guys. It's closest to the regular human heartbeat. I've never read any research differentiating between 1 and 5 hertz. I do know that a lot of acupuncture studies, they use 2 hertz. I'm not 100% sure why they do, but I like to use 1 hertz. I like the way it makes me feel the best. My patients get the best results from that. I'm not saying it's wrong to use other frequencies at all, you guys. Go ahead and play around with other frequencies. There's really cool stuff about electrical literature out there, you guys. There's one really, really cool one. I believe it's 114 hertz. It's supposed to have like some resonant factor or something like that with a bunch of things in the natural world, in nature. I don't use that one, but that is something that some people use. So there's a bunch of different things that you can try. I just use 1 to 5 hertz because it seems to work the best for me. People seem to get the most relaxed from that, and that's one of my biggest goals of treatment is to depress the sympathetics, elevate the parasympathetics, relax the patient's autonomic nervous system to induce homeostasis. This is one of the things that I have changed my mind on relatively significantly in the last year or so, you guys. So I always used to think that leaving the needles in the body for like 20 to 30 minutes was sufficient. That's not true, right? I was wrong about that. It's definitely closer to somewhere around 60 to 90 minutes, or I think it's probably even longer for some people, especially guys. But the bottom line is, you guys, I firmly believe that there's some point of leaving the needles in the body where it just doesn't work any better if you leave them in longer, right? So I think that that time is somewhere around an hour to an hour and a half of a point of no improving efficacy as far as leaving the needles in longer. But to a point, this is 100% for sure true, you guys. The longer you leave the needles in better, the more autonomic nervous system homeostasis you induce, the longer it lasts and the better the patients get, or the healthier your patients will get. So leaving the needles in for 1 minute is better than no minutes. 5 minutes is better than 1 minute. 20 minutes is better than 5 minutes. 45 minutes is better than 20 minutes. And I think there's some point of no improving return for most people somewhere around an hour and an hour and a half. So when I have patients that come to my house and get treatment from me, you guys, I always tell them, hey, I want to try to leave these needles in for somewhere around an hour to an hour and a half. If you want to take them out earlier, that's totally fine. No big deal whatsoever. But I always tell them, just for reference, up to a certain point, and I think it's somewhere around an hour and a half, the longer the needles are left in the body while the nervous system shift takes place, the better off everything is going to be. And we're going to talk about the pattern that the autonomic nervous system goes through while we're getting poked with needles and after we're getting poked with needles, just in a little bit, you guys. So this is very, very helpful for pain pathways, all sorts of stuff, right? So I got a bunch of studies in here, you guys. All the references and stuff are at the bottom of these PowerPoints. The actual articles are included in Teachable too, you guys. So I put the full length articles in here so you guys don't have to go search for them. So all this stuff is included. Needle rotation. This is really, really cool, you guys. This is one of my favorite topics. So it is extremely important to rotate the needles when you stick them into the human body. And the reason for that is, I think this is the best picture that I've found so far. This is from Helen Langevin, you guys. She's a medical doctor. She works for the NIH, which is the only negative thing that she's got going for her. She does seem to be an actual good doctor, which is stunning for somebody working for the government. But she is the world's most respected researcher, I believe, on the effects of acupuncture on soft tissue. So very, very good researcher. She's been doing research forever. So this is a super fancy ultrasound, you guys. So in the right picture, in the right block, the right dark block with the blue little bars over it, that whole square is about 49 square millimeters, you guys. If you look at the little blue bars on the top of the right picture, those are millimeter bars. So there's 7 bars across. So each one of those pictures is 49 square millimeters or 50 square millimeters, more or less. The left picture, picture A, the black dot in the middle of that picture, that's a 0.2 millimeter needle that's just pushed into muscle tissue and without anything being done to it. So that's just a needle that just poked into the tissue. The way that I look at that left picture is that the only tissue that's actually receiving specific treatment is the tissue that's right, or like directly touching that little black hole in the middle, which is the needle. The right picture is that same needle in the same tissue, and all that's been done is the needle's been rotated until it gets taut, or until tension. So the difference between the left picture, picture A, and picture B is, in picture A, there's only like 0.2 millimeters of tissue being treated. In picture B, there's 50 square millimeters of tissue being treated and more, because that tissue tension winding is obviously going outside of that square. So that little tornado or hurricane-like twisting that you're seeing in the right picture, you guys, those are collagen fibers that are actually getting wrapped around the needle shaft. So this doesn't happen if you find totally healthy tissue. What needs to happen for this to happen, you guys, is when a needle goes into pathologic tissue. So if this is a piece of pathologic tissue and the needle goes in there, the muscle or the tissue contracts if it's pathologic when the needle goes in. If the muscle is contracted or the tissue is contracted or tightened around the needle. When you go to rotate the needle, there's little microscopic imperfections in the needle. And those microscopic imperfections pick up collagen fibers and they start to wind collagen fibers around the needle. If you guys have been needled before, you can 100% feel this happening. So as the needle gets tight, you can feel your tissue tensioning and then it stings for a second. That it will even get muscles to twitch sometimes or cause some weird cramps and stuff like that. That twisting of the needle and tensioning of the tissue, guys, is extremely important because one of the most fundamental differences between dry needling and every other treatment that we do, and one of the biggest reasons that dry needling is much more effective, is that dry needling is the only direct contact of anything underneath the skin that we can get. So that direct touching of pathologic tissue just alerts the brain a huge amount more to what's going on in that area, and it tells the brain like, yo, pay attention to this area and fix this shit, right? So I've been hurt a bunch of times in my life, you guys. I played hockey. I've had a couple shoulder surgeries. I shattered my hip in a car accident. I've broken my collarbone 5 times. I lived in South America in the middle of nowhere for a decade. I've slashed myself with machetes all the time and stuff. So one of the things that happens if you've been hurt significantly enough times is you start to notice it's like, oh man, like my body only really seems like it tries to actively heal this stuff for some finite period of time. And then after a certain period of time, it's like the brain and the body just kind of give up. It's not that they can't fix the problem. It's that it's just been that way for so long. Your brain and your body are being inhibited from using all of their superpowers to heal it. So if something in your body is just a certain way for a certain period of time, you guys all know like our body and brain have an amazing ability to adapt to both good and bad stuff, right? So if something has just been a certain way in your body for a huge amount of time, it just stops trying to heal, like diabetic ulcers on people's ankles, all sorts of stuff like that. Surgical sites, tight shoulders. If you leave it just how it is for a certain period of time, it doesn't mean that it's stuck that way. It just means that the body is going to stop and the brain are going to stop actively trying to heal it unless something is specific is done to wake the brain and the body back up to the problem that's there and to reestablish communication between the brain and that part of the body, the brain and the rest of the brain, that part of the body and the rest of the body. All that stuff is very, very important. And the direct touching of the tissue, guys, is one of the most important aspects of needling. And if we can directly touch the tissue, stimulating that direct contact of the tissue more is going to lead to a bigger response from the brain. So I honest to God, you guys, I really think about it this way. I think about when you needle pathologic tissue in the body, it's really like placing a little like miniature person in your brain and just like sending it around and being like, yo, go find the areas of the parts of the brain that are asleep and kick them and wake them up and tell them to get off their ass and deal with this part in the body. That's honestly, I really do think that's what's happening in some way, shape, or form. It's like the needle is like, hey, brain, and it like kicks your brain in that spot and it's like, yo, pay attention to this area. And if you regulate the autonomic nervous system enough, you can really, really improve and totally shift healing patterns and neurophysiologic patterns in the body, which will allow stuff that has been an impairment for decades to get fixed very, very quickly. It's just that, again, you guys, in mainstream medicine, almost nobody ever tries to actually address the cause of the problem. So if you never address the cause of the problem, you're never going to fix anything. And go figure, there's basically no cure for anything at all ever in mainstream medicine because they don't want you to get better, you guys. That is the underlying sad truth. Functional medicine doctors do a great job. Lots of them. Those are the only types of people that I will go talk to, you guys. We're going to talk about that in a little bit. Thanks for watching, you guys. To continue this video, make sure to keep an eye on my channel. There'll be many parts to this series. This is part of our online dry needling 1 course. We have 2 online dry needling courses. We have a live online dry needling course. And we have a bunch of in-person dry needling courses, all board certified and accredited. If you want a discount on our online dry needling courses, check out our school community. It's school.com/CEU, SKOOL.com/CEU. You can get a discount there on our online dry needling courses. on our online nutrition courses, and a whole bunch of other good stuff. I have weekly Zoom meetings there. We have a private community chat room. It's a really awesome community. Check it out. Thanks for watching, guys. See you next week.